What these people do to trace us. Oh my goodness, the equipment they've invented. Oh well, I even feel proud sometimes that we have got them so scared. Yes, really scared. The time. I can't be bothered. I'm going. No, that isn't nice. On second thoughts, I think I'll stay. I told the gentleman that we weren't like his people. We always honor our promises.
Hello. Where is this Mr. Microbacterium tuberculosis? Where are you, Mr. Microbacterium tuberculosis?
I'm here. I'm doing a bit of walking. Need some exercise, don't we, to keep fit? Yes. And since you have difficulty in locating me, I'll get right back on top of the microscope, huh?
Good. Now I'll know where to find you.
Well, why don't you sit down, sir? So then,
I'd like to hear the rest of that story, but it must all be true.
We don't tell lies, sir, like your people. Okay, that's all right. I'll explain it in simple terms. We take up residence in people's lungs and wait for an opportunity to make them feel really ill.
I don't understand. Can you first tell us how you get into people's lungs?
Patient, we have several lakhs of our tribe in his body. A cavity of his lungs will be filled with bacteria. In short, a kingdom. But in our kingdoms, we don't have kings and ministers. We are all equal. Oh, God, this is fun. We're having a lot of fun in this place. Nice, lovely. God, yeah. Yes, marvelous. Oh, great. This is a lovely place. Lovely.
Enough of your bragging.
Do you know why I spoke specifically about the lungs? Remember I told you we could survive anywhere in the body, but it is only members of our tribe in the lungs who can transmit the disease. Nonetheless, residing in a patient's lungs has its advantages and disadvantages. You see now?
And what are those?
The advantages are that we enjoy more good food than found in other parts of the body. In fact, we find ourselves in a comfort zone with plenty of clean air too, you know.
And the disadvantages?
Well, let's say the patients are infected while we are inside of his lungs, and 95% of TB patients have a cough, you know, a cough.
You mean that's a symptom of the disease?
That's right, sir. Apart from the cough, fevers at night, blood in the sputum, loss of appetite, and weight loss are among the other symptoms.
There you go again, digressing.
Oh, sorry, sir. I refer to the symptoms. Oh, but never mind. This is what happens. The tissues in the respiratory tract are very sensitive. If an outsider tries to enter, it reacts strongly to throw him out by means of coughing or even sneezing.
And then what?
So, sir, a cough or a sneeze shakes up the entire respiratory tract, especially in the lungs. As a result, our folk inside the lungs are thrown up and out with the sputum.
Hold on! Are you about to run out? He's coughing again! Hold on! Oh my goodness! That was like a storm!
In such a situation where we are forced out, it would be ideal if there was another human being nearby, and as soon as he breathes in, we enter his body. Otherwise, sir, we will fall on the ground. And because we come out in the sputum, we are also very heavy. But the lighter ones amongst us float in the air. But as soon as the sun falls on them, our folk are destroyed. Oh, that's why I told you windows should be kept closed.
That's why we advise our patients to cover their mouths with a handkerchief when coughing or sneezing, to keep patients in rooms with sunshine and good ventilation, and to collect their sputum in a container and either bury it or burn it. That's what you should be doing.
Now, there you go. You've started saying just exactly what I was about to say.
All right, you say it, smart Alec.
What's that you said?
No, nothing.
So let's say we somehow manage to enter someone's lungs. That's when our troubles start.
Why?
Well, you see, these people have this thing called immunity in their bodies. When a germ like us enters, the body has a large army to drive us out with all kinds of soldiers. And the moment we enter, they surround us. It's amazing how they operate. They're all divided into different types of germs. The ones they have for TB are dangerous. There is one group called macrophages, and they strike suddenly and swallow our friends and completely engulf us.
And after that?
Well, what else is there for us after that but to die? There is another attack group or a defense system called T lymphocytes. Oh, there is no escape from them at all. Yes, it is quite amazing how they know exactly the moment we enter the human body.
In fact, babies are given a BCG vaccine as soon as they're born to build immunity.
That's right, sir. BCG injected into the babies' bodies are really weakened members of our tribe.
Before a newly born child is exposed to a mass of germs, a small dose of synthetic germs are put into his body to create immunity.
That's correct, sir. It happens just like this. They weaken our folk and inject a small dose of vaccine just below the baby's skin. Now, this prevents our folk from being active in that area. Firstly, because they are live attenuated, and secondly, because they don't have the same freedom that they might have had in the lungs. You see?
And then,
sir, the immunocells I told you about earlier slowly move toward us and get familiar with us, and thereafter we remain in their memory for a very long time. No getting behind that.
the baby's inoculation gets festered for a period of 3 weeks to 3 months, isn't that so?
Yes. Due to the battle that takes place between the immunocells and our folk, we lose the battle because our folk have been live attenuated, and in that conflict some tissues nearby are destroyed, and that's what creates a wound and festers. But I tell you, sir, if a team of our germs from a patient's lungs moves into another person's respiratory tract, that's a different story altogether. The ensuing battle rages for months between our tribe and those immunocells. And let me tell you that our army doesn't give up that easily. We carry on fighting and try repeatedly to succeed.
But of course, the BCG vaccine can only prevent TB meningitis and miliary TB.
Oh, you have knowledge of these things too, sir. Well, TB meningitis is what our folk go and spread in between the brain membranes. Miliary TB is the condition that we create by entering a person's bloodstream. And both these conditions are very dangerous. That's why the BCG vaccine is given, especially to save those infants who are most likely to contract the disease. If the BCG vaccine can prevent all forms of TB, well, that will be the day.
I think we have digressed again.
If we lose the battle, the disease is prevented from manifesting itself. But, of course, if we win, the victim gets the disease and will suffer the consequences of the disease actually being manifest in his system.
There are several causes for low immunity levels among people: malnutrition, liquor, drugs, HIV infection, and usage of drugs over a long period to cure an ailment, and of course, irregular use of steroids.
That's right. If we enter the bodies of such people, well, it would benefit us. We can give them the disease quite easily. Those living in ill-ventilated dark rooms who suffer from TB in the lungs pose a far greater threat of infecting others. Sometimes we enter people's lungs and live there without any trouble. On occasion, we spend time indulging in a war with those immunocells in the body. Then, of course, when our strength is reduced to equal levels, the patient doesn't yet get the disease. But if anything causes the body's resistance levels to drop, we react promptly.
That's very clear.
We must talk about that too.
Yes?
It's most important that you keep in mind that if you manifest the symptoms, then you do have the disease.
Don't confuse me. What are these symptoms?
I beg your pardon, sir. A continuous cough for over 3 weeks.
During the day or at night?
I said continuous, didn't I? What are you asking? Coughing up phlegm follows, and then phlegm with blood. Fevers at night, losing weight, loss of appetite. These are the symptoms, and of these, coughing is the main symptom. And there can be other symptoms too, or maybe no other symptoms. It is the patients who have these symptoms who come to you for sputum tests. There's a saying, a continuous cough lasting 3 weeks could be TB, and that you should call at the nearest test clinic and have your sputum tested. It is these test reports that will show if you have TB or you don't.
Why then?
I said earlier, didn't I, that the sputum test is the main test to diagnose TB? Well, there are other tests that you can do which are helpful. You can do exo-testing using the X-ray, the Manto tests, the blood tests, and so on.
You know all this, don't you? I was only testing your knowledge.
Of course, of course. The X-rays help to show the cavities created by the tissues that are destroyed in the lungs where we live. Yet, X-rays don't provide accurate evidence to help diagnosing TB. Do you know why? Because there are several other ailments which affect the lungs and cause similar tissue damage and cavities. Only about 50% can be diagnosed as TB with the X-rays.
Really? I have a little question for you. How do you know all this and explain it so well?
It's like this, sir. I told you that up till now I have lived in the lungs of about 30 to 40 patients. So you see, when senior doctors visit these patients in their wards, well, they explain it all to the medical students, and I have listened to everything carefully.
The Manto test is not a reliable test for TB. See, what happens is that a small quantity of purified protein called tuberculin is inserted just below the skin, and then we check for a reaction in 3 days. If it shows a red ring-like patch, well, it confirms the presence of immunocells. Now, inasmuch as a patient does not show any reaction to the Manto test, well, there are also instances where people who do not have the disease still react to the Manto test. You understand, don't you?
That's clear, isn't it? Well, what do you think of my memory? Well, sir, unlike human beings, we just don't waste time doing nothing. Our organization is very strong. We have assigned different tasks to each of our folk. Well, I used to be in the spy service unit. That's why I'm so familiar with this sort of stuff.
Really? I too would like to visit your kingdom.